Hey guys, I wanted to review with you guys a couple of important points about the hair cycle, and what happens. We have our female patient that's about to go through an exciting hair transplant procedure with Dr. Renagi. And before the procedure, I was just, having a chat with her. And she wanted to know, she's like, I'm just nervous about the shock loss that happens because after each pregnancy, I lost a ton of hair. Well, anyone who's ever been pregnant and who knows what it's like to lose a ton of hair after pregnancy, it's not fun. But why does it happen? It happens because when our body goes through a major event, like a major stressor, emotional, psychological, physiologic, what happens is the blood gets taken away from the non-vital organs like the hair follicle to the heart and the lungs. And when that happens, it almost starves the hair follicle and kicks it out of the anagen or resting phase into the telogen phase, which is kind of the purgatory of falling out. It triggers it into the catagen phase. And so that's called telogen effluvium. And so how can we prevent that? Well, there's not a lot of preventing going on because the body's doing that as a physiologic mechanism to support the hair. But what we can do is help support it with injecting your own body's growth factors back into your hair follicle to suddenly bathe that hair follicle with a lot of good nutrition so that it doesn't perceive that hair loss as being permanent. So that's one thing. The second thing is the hair loss that happens after hair transplant. So any kind of surgery can cause people to lose their hair. Why? Again, because the body wants to use its resources for the vital organs and not necessarily the non-vital organs, but the hair that we like. So what do? We actually do inject with PRP throughout the process of hair transplant. And what that does is instead of it taking 12 months to become your own hair when we transplant it from one area to another, it shrinks it down to about 9 months. So when we transplant a hair follicle from over here to over here for women's whitened part, or obviously for men as well, it has to cycle through those 3 cycles of hair loss: anagen, telogen, catagen. And when you implant it, it needs to fall out. So you are going to have a lower density of hair for the first 9 to 12 months after hair transplant before that baby hair follicle becomes your own, because it needs to cycle through that process. So the good news is when we inject your own body's growth factors, that helps minimize that time frame, accelerates that baby hair follicle becoming your own, and gives you awesome results.